One of the things also about heart and health is it's almost like a one-stop shopping center.
Yes, yes, it
it's
is.
like one call does it all type of thing. Because you have the family practice that's going on. There's the cardio, there's the OMT, there's so many other things that are going on. So when people first come into the practice, now you must see hundreds of the colds and the flus and everything like that. But when they last longer than they should, it's either having to do with an immune response, right, with your body,
Right.
or it possibly could be some more physical stress that's added to that.
Absolutely. And, a lot of times people will come in and they're like, I've been suffering for a month with this cough that just won't go away. And, oh, I just thought it was a virus and it would just go away. But a lot of times we're catching patients that have like a walking pneumonia, for example, and they need antibiotics. And, so we try to get them in timely manner. We could do in-house testing to make sure it's not the flu or anything like that. And then, we do the assessment with the patient. We do my physical exam and everything. And if, they're too tight and they're not taking good breaths or anything like that, we can give them a nebulizer treatment to try to open them up so we can get them to breathe better.
And then you test the pathways after that again, right?
Yeah, we check their blood counts, make sure, do they have an elevated white blood count, what's going on with everything else to make sure that they're, on the road to recovery and feeling better.
And we were talking just before the program, we had mentioned something that's very dear to your heart and something that you and the rest of the staff are constantly looking out for when people come in, is the epidemic, which is now diabetes, which is basically out of control in the country.
Yeah, diabetes is one of those silent killers where a lot of patients, you just don't know. You kind of say, oh, I'm a little bit tired, or oh, I'm going to urinate a little bit more frequently. It'll go away, or oh, I can deal with it. A lot of times these are the first signs of diabetes, and that's the time that you want to just come in, come get seen. We do a lot of in-house testing. We'll do your finger stick with your sugar test right there, and then we could do a test in the office to see how your blood sugar is running over the last 3 months. We do education and diabetic counseling. We have a diabetic nurse that is there on staff to help us to help manage your diabetes with medicines and with your lifestyle. Because a lot of times if we fix the lifestyle, little changes can go a big way.
And when we say lifestyle, just to get everybody in the audience so they really know what we're talking about, we're talking change of diet, okay?
Change
So
of diet,
a lot of
yes.
people, hitting the fast food places, high fatty content, you already have a high cholesterol level, you have diabetes, you're asking for trouble.
Yeah, so diabetes is an equivalent of heart disease. So a lot of times maybe your cholesterol will be okay and your blood pressure is okay, but you have diabetes. And a lot of people don't understand the link between it being the equivalent of heart disease. So we're really, really strict on how to get you to eat a little bit healthier. And again, like I said, you can make one change and it make a huge difference in your numbers.
Somebody who uses a lot of salt in their diet, for instance. They're saying now that, table salt is like the worst enemy, and that you should stick with sea salt because it's actually like a mineral. It's, your body takes it as a mineral, not as like regular salt. All these other things. So like people, like first thing they think when they hear this is they're going to be eating nothing but whole wheat bread and crackers for the rest of their lives. And that's not true, because most of the diabetic diets that are out there is some flexibility,
Yes.
but again, it has to do with watching your levels and everything like that, because you should be testing yourself, every day, every other day?
Well, depending on how severe your diabetes is, you should at least be checking it once a day when you're fasting, which means, when you wake up in the morning before you eat or drink anything, you check your sugar and see if it's in that nice normal range of 70 to 100. But a lot of times with diabetes, it's the after meal sugars that are elevated. And sometimes that's just a portion control problem. You might be eating healthy and eating like the whole wheat pasta, but you're eating 2 or 3 helpings and you don't realize it. Because the way that the nutrition labels are set, they just say, oh, look, it's only 110 calories or 20 grams of carbohydrates. But one serving size is like, the size of my palm. And then you're eating, once you cook it, 4 serving sizes. So multiply that 110 by 4.
So like opening the bag and taking out one potato chip.
Correct.
It's pretty hard to do.
Right. Try to portion before you eat. Don't just sit there with the bag open and continually, because then you don't know what you're taking in.
Right. That's why if you get like a little paper bowl or something, you put something in there, then it helps.
Right.
And it also helps too with the measurements. And that's another thing about the diabetic diets is that you could have 1 6-ounce bowl. So after a while, you know what a 6-ounce bowl is. You know what 12 ounces is. You don't have to be sitting there weighing like a scale or in Dr. Frankenstein's lab trying to measure everything
exactly.
Because some people go to extremes when they find out that they have this.
And it's tough to do, especially, working all day, and then, are you going to bring your scale to work with you too? Or are you going to make your lunch before you go? So there's good little indicators, like the size of your protein should be like the size of your fist when it's closed. That's the size of your protein. So not a big porterhouse steak, which is nice and juicy, but, the size of your fist. So nice piece of chicken, nice piece of lean protein, fish, things like that.
And again, all this stuff is available at Heart and Health as far as
absolutely.
dietary.
We don't just sit there and say, take this medicine, we'll see you in a month. We'll sit there, we'll discuss why you're taking that medicine, what that medicine does for your disease process. And then we give you all the nice little, tricks of the trade with diet and exercise and try to help you along.
Well, Dr. Happel, I'd like to thank you for coming on the program.
Thank you so much.
Giving us a little bit more insight to heart and health. And we'll be back with our next guest, Dr. David Catastine, who's a cardiologist, in just a minute.